I'm going to have a heart-to-heart talk with you today about sports hernia rehab options. The reason why I want to make this video is because we do have a lot of people who have reached out to us over the years about groin pain that they feel is a sports hernia that they've just failed care, they say. And so throughout this video, I'm going to just discuss heart-to-heart about maybe the things you haven't tried yet. A lot of you feel like you've tried everything because you've tried all the options that have been presented to you, but you might not have tried all of the options that there are because those people who suggested or the articles that you read have not presented those options to you. By the way, I do have a very long article on sports hernias and treatment options, and it was updated as a couple years ago. It's in the link below. You can certainly read that as well. We also have a podcast about it too. So first, I'm going to describe a little bit of the location that we're talking about, just so you know you're on the right video. And so this is the front side of the body. Okay, this is the skeleton guy. There's no muscles on this dude because apparently it's really hard to find skeletons with muscles on them now. And so this area right here, this is a bony area that you can feel on yourself, which I'll show you in a moment. And this is another bony area that you can feel on yourself, and this is called the pubic bone. This is called the ASIS. And there's a junction right here that if we just kind of put our hand right here and our fingertips down to this area, it's right around this area that most people feel the pain, but a lot more so it's upward towards it. And so I'm going to show you on myself. So I like to have people put their hand right upon their hip right here, or like on the fleshy area, the soft area, and slide it down. You're going to feel an area where it feels like it's kind of a bone. We're going to take this finger, the index finger, then it's just going to point straight down into the pubic bone area right around there. Now let's see if I can get closer. So the pubic bone right around there. Let's get this mic out of the way. How do we get this mic out of the way? Okay. And so the pubic bone right there, and so right above it and then to the side here, just like an inch and an inch is their area where most people will say they're feeling their sports hernia, okay? So you might notice that you all have pain in different areas too, like in the crease here, sometimes into the thigh here as well, and sometimes into the outer part where we kind of started there. Now, there is going to be another video on the actual symptoms that you can use as a way to identify if you have a sports hernia, but the areas that we're talking about right there, a lot of times people end up getting something done called passive care. And so just to give some ideas of how to categorize these, because I'm not demonizing the passive care. It's helpful when it's helpful, but when it's not, it's not. And a lot of times it's very easy for people to do passive care and to have to get passive care done. Passive care is things that you don't need to do to yourself. It's things that other people do for you. I apologize, I'm burping today. So passive care is things that other people will do to you or for you. Stretching, massaging, cupping, needling, adjusting, medication, injections, surgery. Those would be all like basic passive care. Medications too. There's not, these things are helpful, and we find that they're helpful for a reduction of pain, and a lot of times they'll get pain to decrease when the body's not challenged. And so I know a lot of you who are dealing with this groin pain, a lot of you it's not consistent over the entire day. A lot of times it's the people who feel it when they want to go back out to the sport that they like, to their recreation sport, their football, their golf, their rugby, their soccer, things of that nature. Even sprinting and running sometimes bothers people. And so it's a challenge for a lot of people where they're like, I've done all this care, I've done this passive care, we'll call it, the passive care. It feels good, I feel like it's right because my pain is much better, but when I go out and do something, it comes back again, so I don't know what to do. I feel like I've tried everything. You haven't tried everything. You've tried a certain small category of care. The larger category is actually called active care. Active care is things like rehabilitation of the hip. It's things that are effortful. Actually, I should consider as that. Things that will take effort. It's things that you have to get your body to do. It takes effort to do so. You will probably sweat. You probably will get sore, but it should not increase your pain. The active care, it takes a certain skill set to be able to apply. I should start with that. In a setting where you're having active care start, such as you're doing clamshells or glute exercises or ab ones, and it tends to aggravate your problem, that's the wrong exercise for you, or it's the wrong scaled approach to that exercise. Exercises in the active care category can always be scaled up or down based upon what you can do on your own, what you can tolerate, what your body's tolerances are. I think we oftentimes forget as clinicians that people who come in with these problems, say you've had it for a year, it feels like it feels better. You haven't really done anything active for a year, not anything that you were normally trying to do or the thing that you want to do. And so to be able to hand you a golf club and tell you to go ahead and rip on the ball and test it out, you haven't built the tolerance to that amount of movement or the speed of the movement. And so a lot of times the active care approach, the whole point of it is to get your body to become supported again and prep it for that movement that was the pain generated in the first place. And so what does this type of thing look like? Well, it might look like glute bridges or squats or deadlifting to a certain amount. I know people have their own stereotype of deadlifting. It doesn't need to be with a barbell or a trap bar or a kettlebell. It could just be the simple movement of a hip hinge. That's fine too. But a lot of times if we get the hips to work better and we get the core to have some endurance, then we get people to return to the activity that they want, okay? Because we built some support systems. Now, again, I'm going to clarify, say it again, active care should not hurt. If it hurts, you're doing it wrong, you have the wrong exercise, or you need to communicate better with your clinician or your rehab person to tell them what you're feeling, because we can't feel what you feel. So if it hurts during wish, say you get to 5 reps of something and it hurts on 5 but not at 4, say something. We can do something called clustering the set. We could do 4 and then break, and then 4, then break, then 4, then break. And then at some point your body becomes tolerant of that 4, and you can do 5, 6, 7, 8, 9, and then we do 9, 9, 9, 9. And then we might advance the exercise completely. Movement is medication. Picking the right movement medication it takes a skill set, it takes a skilled clinician to do so, and a lot of times patients don't always understand how powerful a selection and an application of a movement-based correction, such as an exercise, a core one, a hip one, can be for their problem. We had a patient the other day who had groin pain, and she had it with running. Nothing caused it, it just kind of happened. It was right in the crease of the groin. And we did a single exercise. We did something called a hard style plank. It reduced her groin pain completely with her pick of an exercise that provoked it, which was a squat. Absolutely zero pain after doing 2 minutes of a on and off hard style plank. Now, is a hard style plank right for you? I have no idea. It might be too hard for you because based upon where you're at right now in your condition, but it was right for her. So you get the point. What I'm saying here is that passive care is good to reduce pain so pain doesn't corrupt your movement. Now you're into a movement setting. Movement should happen. It should be challenged, and then you have to challenge it with a little bit of endurance challenge and a little bit of strength challenge. That should be a good foundation for a lot of people to return back to their sport, at least in the fundamental steps. It can get way more complicated than that, but through this conversation, I hope it's at least helpful for you guys to understand that you have not tried everything if you've tried things that people did to you. At this point in time, if you've done that and it feels better, but it doesn't really, you don't feel like you can return to activity, the answer is not surgery. The answer is do the other things first. If those fail, then perhaps maybe you need a surgical intervention. But in my opinion, if you have not done that whole spectrum of stuff and tried it and proved that they don't work, you have not deserved your surgery. Okay, I mean that in the nicest way, and I had a friend explain it to me like this. He said, he said, I tell my patients they need to earn their surgery, meaning they have to prove beyond reasonable doubt that everything else doesn't work. They can't just jump in and say this surgery is the answer, because it isn't. It's not the answer for a lot of people, and even afterwards, if you have the surgery done, you have to rehab after the surgery, right? And so sometimes we have people do something called a pseudo surgery. They did all this, and now they're like, I want to do the surgery because nothing's working. And we'll say, hold on, act like you did the surgery. What would you have to do? Well, I would probably miss work for a couple days, and I would spend a couple days off my feet, and then maybe I'd probably have to rehab like 3 days a week. Good, do that. Don't do the incision. Do all that. Prove that that does not work, and then you have earned your surgery. Okay, I mean that in the nicest way. Again, heart-to-heart conversation. But this is what it comes down to a lot of times for people, is you have to try something else. When you pick the right thing, it will work. And I'll be honest with you guys, for a sports hernia groin presentation over the past 5 years, I've only had to send one person to have a surgical intervention. Everybody else was fine, okay? I know it, and I know it probably doesn't coincide with what you're reading upon with a lot of the articles on the internet. Read the article I wrote, okay? A lot of those articles are pretty old. I know that mine's 2 years old at this point, at the time of making this video, and I plan on updating it as I see research start to expose itself. But most of you can get better. A strong majority of you will get better. You just need a good guidance of what to do and a heart-to-heart like this. And so if you're looking for suggestions, again, we do have a link below. We try to supply, there's an article down there, but we try to supply you guys with some free gifts of things too. And so I don't know at this point if we're gonna have a free gift involved. It might be an audio or a video going a little bit more in depth about stuff. But if there is, it'll come up on the screen, or there'll be a link in the bottom, and that'll be free. Okay, so you guys can better educate yourself about what to do next, okay? You can get better, don't get discouraged, this can get better. We've seen a lot of people through you can check our Yelp reviews, all the ones that are even hidden, because they like to hide like hundreds of them in there. They're all 5-star reviews, and a lot of times you read through that, you'll see a lot of low back and hip people and groin people who've gotten better, okay? And some of those stories might resonate well with you. So please go through and check those out. We'll see you next time. Subscribe to the channel, subscribe, because you can always use the search function to search sports hernia, and a lot of the related videos associated with this will pop up. So check it out. We'll see you next time. Thanks for watching.